health facility, which is being led by the health CS, Susan Nahumicha.
To give us your speech and eventually launch this assessment for us. Karibu sana. Let's welcome him with clap. Thank you.
Thank you, CS. We can be seated. Thank you, CS. I want to confirm that relationship that you've talked about has been growing and is much better than all the years we've ever had the devolved levels of government. The CS, the Ministry of Health, Madam Nakumincha, the Chair of the Health Committee of the National Assembly, Dr. Pukose, the PSCs of the Ministry of Health, PS Hari Kimtai, PS Mary Muriuki, the ever-acting Director General, Dr. Moth, the CEO of Nursing Council of Kenya, Dr. Edna Talam, all the other ministry senior government officials, and our teams that are going out there to carry out the exercise, and the members of the fourth estate. I am here not only as what has been given the privilege to be the chief guest of the day, but I'm also here on behalf of the Council of Governors to say that we are part and parcel of this exercise, and we are giving it a nod, and we are not walking alone in this. We are together. And because I'm here on behalf of governors, allow me to say what the Council of Governors needed to say, then I'll say what I needed to say as a person thereafter. Happy to join you here today at the health facility. This census comes at an opportune time when both county governments and the national government are focused on strengthening primary health care services as a vehicle to obtain mental health coverage. As you know, we have a noble task for ensuring all Kenyans have access to high quality services when and where they need them in financial catastrophe. This health facility census activity will contribute towards that goal and help us better operationalize all the networks in Kenya. And in this regard, let me take this early opportunity to say that county governments and the Council of Governors are working with you closely throughout this activity, Madam CS and the Ministry. Gentlemen, the primary care central to Kenya health agenda main component for the Kenyan Vision 2030 and the Manifesto of Kenya Kwanza. Indeed, evidence has linked good primary health care systems to improved health outcomes, such as skilled deliveries, immunization coverage, and antenatal care. Additionally, effective primary health care services reduce the number of people needing services from higher level health facilities, improve referral mechanism, and improve the overall cost efficiency of the health systems. Despite this, primary health care has over the years remained very poorly financed, quite fragmented, and has a very weak referral link in the health systems. These are the gaps that this government, both at the county and the national level, are addressing as we move forward. Finally, the Council of Governors remains fully committed to maintain the momentum and focus on attaining universal health coverage. We'll work in collaboration, in cooperation and consultation with all the stakeholders, including the national government, for the delivery of quality, affordable, accessible care to all the Kenyan citizens. That is what the Council of Governors needed to say. Allow me to say, as a person and as one of the consumers of this very important exercise, because health is devolved, and it is one that takes a lot of our energy, budget, and even resources. First and foremost, CS, we welcome the gesture of devolving a few doctors from the ministry. We know you are adored with the best that there can be. They may be out of time, been out of touch with what happens in the wards, but I can assure you they will play a very big role in ensuring that those wards and those systems usually run professionally, because we are struggling under the weight of burden, or we are struggling at the burden of shortage of doctors, shortage of health personnel that counties can only afford. It's only that when you're devolving them, I would request that you fully devolve them, because sometimes we have gaps when you devolve to us. Officers who still answer to the ministry, they are usually lost in between. You're looking for them and they say that we are in the ministry. So when you devolve them fully, including the payroll, but not the resources. You devolve the payroll, but you still pay them from here. We will be taking care of the figures, you take care of the monies, and we take care of the staff. I want to thank Dr. Pukose for coming up with that idea. I served with him in the National Assembly. At one point, he was my vice chair for health. And I was always wondering why Dr. Pukose, because I was comparing him with